On the eve of World Schizophrenia Day 2021, let's pledge to increase awareness about the disorder and educate people about the challenges faced by the patients. The word schizophrenia is over a century old, yet it makes many people uneasy. Schizophrenia comes from the Greek root schizo, which means split, and phrenia means mind, to describe the fragmented thinking of people with the disorder. However, the public has a fundamental misunderstanding that this is an illness of split personality, demonstrating prejudice and misconceived notions that those with schizophrenia are unpredictable and dangerous. Unhelpfully, the media, public, and even the clinicians have used the word to describe violence and disturbances. Unsurprisingly, the S word comes with a stigma and acts as a barrier for individual seeking help due to fear of being judged on preformed notions. Consequences are obvious: a delay in treatment, unnecessary suffering, and more unsatisfactory outcome of an illness. Notably, this is a treatable condition from the outset. Majority recover to reasonable social, occupational functioning with integration into the community. Schizophrenia is a disorder or an illness of the mind that affects how one feels, thinks, and behaves and perceives the world. Clinically, it is listed under the category of a psychotic disorder. Psychotic means out of touch with reality or unable to separate real from unreal experiences. Remember, loss of touch with reality and fragmentation of thinking occurs during an acute phase of an illness or a long-term untreated condition. So what are the early warning signs of schizophrenia? In the early phase of illness, the symptoms can come on slowly and even seem harmless, like having trouble sleeping or concentrating. Other signs may include social withdrawal, deterioration of personal hygiene, inability to express emotions, odd and irrational sentiments, being extremely sensitive to criticism, using strange words, being suspicious, anxious, and depressed. The diagnosis. Well, the diagnosis of schizophrenia depends on presence of certain symptoms that are categorized as positive or psychotic and disorganization symptoms, and negative, which is mainly to do with motivation and affect. So positive symptoms include hallucinations, wherein seeing or hearing things that don't exist, and delusions, wherein one believes that others are trying to harm them, or having fear of being constantly watched. In addition, one suffers from disorganized behavior such as withdrawing from others, having difficulties caring for self, and speaking strangely or confusingly. Negative symptoms include lack of motivation, apathy, loss of interest, reduced energy levels. Features should be present for several weeks or months for it to be diagnosed as schizophrenia. Importantly, psychosis can also occur in other medical conditions such as brain tumor, epilepsy, thyroid problems, alcoholism, illicit drug misuse. Ruling out these conditions are essential for diagnosis of schizophrenia. Possible causes of schizophrenia. There is evidence that symptoms are manifestations of brain pathology rather than disturbed psychological development or just bad parenting. Studies involving brain imaging and electrophysiology tests have demonstrated that people with schizophrenia have abnormalities in brain structure and function, and there is indisputable evidence of genetic vulnerability for schizophrenia. Impact of schizophrenia on daily life. The effect of the illness can be devastating both for the individual and those around them. When ill, the sufferers can be occupied by their inner experiences, which disrupts work and daily life. At other times, they can worry about reoccurrence of the episode, which can also be quite disrupting. The symptoms can dent the confidence and motivation and initiatives, and the paranoia and suspiciousness can drive them away from their loved ones. In some cases, people may misuse alcohol and drugs to relieve the symptoms. So how common is schizophrenia? Well, it affects 1% of the population. Symptoms often begin to manifest in young adulthood, sometimes starts later for women. Illness can be periodic or continuous depending on the extent of difficulties or delay in treatment received. So how do we treat it? Gone are those days when individuals with psychosis were locked away in asylums, situated away from the cities. With the advent of effective antipsychotic medication in the 50s, advanced our understanding of the illness, early diagnosis and treatment, and options for successful treatment and normalization of individual and reintegrating them back into the community. The most effective treatment approaches would be an integrated care plan involving a combination of medication, psychotherapy or talk therapy, and targeted social interventions, which includes confidence building, assertiveness, engaging in meaningful activities, and involving them with support networks. Significantly, education and support for the family will reduce carers' burnout and ultimately minimize the risk of reoccurrence of the illness. A mindful and person-centered approach will enable sufferers to control their symptoms and live a more fulfilling life. Thank you for listening. I hope you will share this video to raise awareness of this rare but a significant mental health problem. Remember, schizophrenia is a treatable condition, and those suffering revert to happy, productive lives when they address their health matters in a timely, professional manner.